Let's start this video with a beautiful look at a mall here in Saudi Arabia. The indoor malls here are massive and just amazing. All right, so we are filming in a little different environment. I'm trying to, before it gets to be too hot in the morning, I'm trying to film and because really by about 8 a.m. and pushing into 9 a.m. it's already over 100 degrees here in Saudi, and in the evenings right about now, which is about 6 p.m. in the evening, it's not bad. It's not too bad, and the main reason is because the camera equipment overheats. So I'm trying to find different locations to film around the base and around my villa. But the reason why the majority of the video gets done indoors is because of the heat. So hopefully if this works out all right and if the lighting looks okay, we'll go with it. All right, let me get a quick drink. All right, this video is based on a question that came in asking about medical insurance and how that works when you're overseas contractor. So let's explain this, how this works. This is a really good question. After years of military contracting overseas, and I'm getting ready to retire, I thought I would pass on the information that I learned over years of working abroad to inspire others to reach out, check out the world, see the jobs that are overseas, and learn something about yourself. And you probably heard a lot of people say bits and pieces about this, other people talking about it. I want to clarify exactly how it worked for me. I've been on many different contracts, and this is how medical insurance has worked for me. The contracts that I did in Hawaii were in the U.S. Even though it seems like you're in another country, you're still in the United States. But their medical insurance programs in Hawaii are unique, whereas they want you to have a Hawaii medical insurance. They don't want you to bring some national program or some overseas program. They want you to have a Hawaii medical insurance program. They had very good programs there. The employer that I was working for in Hawaii paid almost the entire premium and also covered my family as well. Excellent dental program. Vision program, everything. And it was capable of being used anywhere in the United States if necessary, even though it was a Hawaii-based company. They had affiliated with Blue Cross and Blue Shield. So that was how my Hawaii contracting experience worked. It was seamless, outstanding medical care available in Hawaii. Hospitals, clinics, no overcrowding. You could see someone the same day. Emergency room capabilities, first rate. Everything was available there in Hawaii. If you didn't have medical insurance, I'm sure it would be amazingly expensive. It's a very expensive place to live and work in general. Hawaii is probably one of the most expensive places in the world to live. But working as a contractor there, as far as medical insurance goes, I had very good coverage there and easy to use the coverage as well. Now, moving into working in the Middle East. The companies that I have worked for, they basically give you your medical insurance for your family. If they need it in the United States, they will get that coverage. You're going to pay quite a bit for that co-payment. The overseas Middle East companies that I have worked for, and there have been more than one, they basically take care of your medical insurance. You're covered, all right? But we're going to discuss that in more detail here. But if you want your dependents covered, you're going to pay extra for that. That's just the reality. And it wasn't cheap. It wasn't as much as if I was paying full coverage myself for the family, but the co-payment was pricey. All right. The contract that I'm on right now in Saudi Arabia, I pay a co-payment for the family, and it's pricey. It's not terrible. It's not what I would pay for full coverage, but it's pricey. But my personal coverage is pretty much covered. Now, what is it like when you are overseas if you need medical care? This is important, all right? And one of the reasons why, before you go, you want to get as much done as you think you're going to need to get done for that year. And the reason why is, especially dental, and also any other issues that you think you have, like any surgeries that you think you're going to have, you don't want to get over there and have these issues. Dental issues, serious pains, things like that. Because if they put you on a plane and they fly you out of Afghanistan and they fly you to the UAE, you go into Dubai to get medical work done, if you go as far as Thailand to get medical work done, you will be burning up all of your leave, burning up all of your emergency leave, medical leave, whatever you got, you're going to start burning it. Okay? Also, you're going to be looking at, now you're off the contract, it doesn't look good on you, they don't like that. I know it seems insensitive, I get where you're coming from, it seems insensitive, but contracting is different than being an employee in a company in the States. You know, you are basically, you need to be there, you need to be on site, you need to be working, you need to be fulfilling the job that needs to be done there. And that's the way the situation is. So you don't want to have a toothache that's so bad that now you need to get on a plane and go get dental work in Dubai. You're going to start burning everything. It's going to cost you money. All right? What services are available in the Middle East on base? There is a clinic on base. If you had a fever or something along those lines, there are personnel on base that are basically just going to isolate you, give you some medicines, and you won't have to fly out. If you had, say if you get a torn ligament in your knee and you can still walk on it, it's hard to say. You might be able to get it wrapped up there, and you might be able to stay on site and continue working depending upon what your job is. If you're working an evening watch at a desk, something like that, it's sketchy. It's sketchy. Injuries like that, serious injuries, if they have to put you on a plane, fly you out of there, that might be the end of your contract. All right? So you want to get that stuff taken care of. But that's the way the medical insurance works. And that's what facilities you have available. You have a clinic available on base. You don't want to try to get prescriptions on base overseas. All right? When I was contracting in Hawaii, no problem. You go right to the drugstore, you get anything you need. When you are in country, in the Middle East, you bring with you what you're going to need. It's checked. Now you might say, well, I'm taking a pill every day. They understand that. And you can actually get certain permissions from your doctor that you have a job to go overseas. All of that paperwork is shown to your doctor and to the pharmacist, and they will take care of you with what you need to go overseas. All right? This is not an uncommon thing for pharmacists and doctors, but they need to see your agreement that you have taken this job now and that you're flying out on this date and that you have a 1-year contract. They need to see these things. The reason why I say that is I take a cholesterol medication every day, and so I have done all these things. Okay, I've done these things. I've talked about it in earlier videos. Buy your vitamins on base. Don't bring any type of vitamins. Buy them on base, and just take your vitamins like you normally would. But prescriptions, make sure you get them before you go on that contract, because you're not going to get them on base. And they don't have the system set up yet where they're going to start mailing them to you. Some people have that set up. Maybe through family and things like that. It's iffy. Getting any kind of pills in the mail into the Middle East is very sketchy. you really want to have those things already set up, okay, before you go. And of course, if it's a serious medication, it can also mean that you're not going to get the position. All right, it can happen. There are people who take certain medications, and that may be a no-go for going overseas. But for myself, speaking from my own experience, I take a very common everyday cholesterol medication, no problem. I've been having it through multiple contracts over the years. My doctor writes me a prescription for what I need. The pharmacist fills it. I bring them with me. Good. I will tell you that here in Saudi Arabia, you also have the ability to go out in town and buy medications from the pharmacist cash, and the prices are not that bad. They're not as good as in Thailand. The Thailand prices over the counter for just about all medications that you could possibly think of are very cheap. But here, the generics are not bad. If you are dead set on getting a name brand, you're going to pay, but they're available, and you don't need a prescription. So that's the situation in Saudi. All right, medical care here. The company that I'm with has medical insurance that covers me here in Saudi Arabia, and there's world-class medical care available here if I need it. I try not to need it. All right. With the current thing that's going on at the time of this filming worldwide, they have brought that medical service on base and given it to us. All right, so we got that on base taken care of. We didn't have to go out in town, but it was available out in town. So you could get. All right, so we are going to summarize a few things to get done before you go, before you take that contract overseas. I want you to make sure you get your teeth checked, x-rayed before you leave. Ask your doctor, is there anything that I should get done in the next year? I want to get it done now. If you got a loose filling, if they see a crack, you don't want to need a crown. You don't want to crack your tooth when you're in Afghanistan. You want to have your dental work done for a year before you go. Get a good cleaning, because you're not going to get a cleaning over there. If you get vacation time, 6 months in, you fly to Thailand, you can get dental work done, cleanings done, full physical if you wanted to, pick up prescriptions if you needed to, things like that. All those services are available in Thailand, and from the Middle East, very common that contractors go there. But my recommendation and what I did is before I left for those one-year contracts overseas, is I made sure I had all my dental work done for that year. Cleanings, everything needed done. And then at the 6-month marks, when I would travel, I would get anything else done that I needed cheaply in Thailand, okay? In the future, I'm going to be making videos from Thailand the later half of this year. I'm going to be actually physically in Thailand making videos, and I will show you the prices of all the clinics. We're going to go over all that. I'm going to show you where to go for medical and the prices. All right, and we'll talk more about that then. But that pretty much covers. Again, it was an excellent question, and I appreciated it. We talked about medical insurance, contracting in Hawaii, contracting in the Middle East, what you can expect for the medical insurance, and what services are available for you, all right? And that's it, and I hope you have a great day, all right?